Yeah, so my name is Mallory Mahalko. I grew up in the suburbs of Philadelphia, and I went to the University of Pittsburgh for my undergraduate career and majored in applied developmental psychology.
Awesome. What would be your current role right now? And what hospital are you working in if you're working in a hospital?
Yes, so I'm currently a child life specialist at Children's Hospital of Philadelphia. I work in their emergency department, which is a level one trauma center. We have 75 plus beds in our emergency department. And because CHOP is what it's called, Children's Hospital of Philadelphia, is such a leader in medical research and has so many doctors in the forefront of research, we see a really vast range of reasons why children and families come to the hospital and come to the emergency department. So on a day-to-day, I see new onset diabetics, new onset oncology diagnoses, accidents that require MRI, CT, ultrasound, a lot of imaging, appendicitis, laceration repairs that require stitches, psychiatric emergencies like suicidal ideation, anxiety, depression, disordered eating, gunshot wound traumas, respiratory distress, fractures requiring sedation and casting, foreign body removals. I know that's a lot of different procedures, but
Yeah.
a lot of complex medical care needs, a lot of kids with developmental delays. So a lot of different things I see on the day-to-day at CHOP. I'm really fortunate to be able to see a lot of different experiences. Because CHOP is such a leader in the research that I previously mentioned, we get a lot of international families too. So children and families that are literally coming from the airport with suitcases and bags, coming straight to CHOP just to get this kind of medical research and help with their diagnoses. Philadelphia was also one of the only cities to be taking Afghan refugees through our airports. So CHOP was really involved with them, meeting them at the airport, doing screens at the airport for children and families, and then sending them straight to the emergency department if they needed care. So I not only see vast range in different procedures, but I also see a lot of different cultures, a lot of different languages spoken. So it's been a really great experience so far.
Needy. I did my undergrad at Ohio University in the Child and Family Studies program with the concentration in child life. And then I also did the one-year master's program at Ohio University in the same program.
Great. Can you share about your current role right now and what hospital you're at?
Yes, I am at Norton Children's Hospital in Louisville, Kentucky. I work at the downtown campus on our burn trauma ortho floor. So I see a lot of, obviously, burns. I see a lot of car accidents, gunshot wounds, a lot of like downtown area. So it's kind of a little bit like lower economic status. So you kind of see some of those more tragic things happening. I also have overflow of our brain tumors come to my unit because I'm more of a surgical floor. So I deal a lot with that acute stage of learning that a child has a brain tumor, and then as well as just the normal ortho things like kid fell off the monkey bars and broke their arm, or was at a basketball game and fractured their leg or something. So I kind of have a big variety of population that I see, but I also am going through our facility dog program. So I will be having a facility dog on our trauma unit to kind of help with that emotional support and helping with ambulation or just helping get out of bed and stuff, because sometimes our kids there for less than 24 hours, but then we also run into those kiddos who are on our unit for a month at a time. So just having something else to look forward to, I'm really excited to bring that aspect into my role.
Gretchen Greenlee, and I am from Ohio. I did my undergrad at OU. I graduated in 2014, but my degree was in communication study from Scripps.
Awesome. And tell us about your current role as a child life specialist, in what hospital you're at and what units.
Sure. So I work at Kravitz Children's Hospital at Mount Sinai in New York City. I work on our inpatient hematology oncology unit.
Great.
Well, I am from the Columbus area of Ohio. I grew up in a little town called Delaware. And then I did go to the Ohio University for my undergrad. I have 2 degrees for my undergrad, psychology, and then African studies or global studies of Africa. And then I stay to pursue the graduate program through Child Life.
Awesome. And what are you doing right now?
So right now I am a part of the Cleveland Clinic. My role title is Administrative Program Coordinator, and I work for the Thrive program here at the Cleveland Clinic. Thrive is a program that supports PCNAs, which are nursing assistants. They're called different things in each hospital setting.
This is Michelle Lenzo. I'm from the Cleveland area. I did my undergraduate at Kent State University. I majored in psychology and minored in human development of family studies.
Great. What brought you to OU?
So I knew, I found out about the Child Life field in my undergraduate program, and I knew that I didn't have all the required courses. So I started to volunteer at Akron Children's Hospital to get more familiar with the Child Life field. And then, I fell in love with it from there. And then I was like, okay, I guess I'm getting my master's. And I looked at a few of the grad programs, and I got accepted to OUs, and I just loved the environment. I met with Dr. Shabbat and just kind of, fell in love with the program, and it was just very family oriented, and it just, it felt like the right place for me to be.
Exactly. Can you share about your current role right now and what hospital you're in?
Yeah, absolutely. So I am a certified child life specialist at Akron Children's currently, actually. So I work in the inpatient behavioral health unit. So it's not your standard child life role that you'll see on the medical floors. I started this about in beginning of November, so I'm still kind of fairly new. I was at Cleveland Clinic Children's prior to that, working in the surgery department.
Yeah, my name is Rachel Dawson. I'm from Columbus, Ohio. I completed my undergraduate at Ohio State University, and there I studied human development and family science with I think I had a minor in psychology, I think. It's been a long time now, but.
Yeah, and then now you went to Ohio University for their 2-year graduate program in Child Life, right?
Yes.
Awesome. And then can you just tell me what your current role as a child life specialist is and what hospital you're at?
Yeah, so I graduated from OU's 2-year graduate program in 2021. I had a delay due to the COVID pandemic, but I accepted a job in Louisville, Kentucky, working at a community-based hospital. So it's pediatric with an adult. And it's definitely different than what I did in my internship and my practicum. I didn't see myself ever, really enjoying a smaller setting, but as the months have gone by, I've been there about 8 months now. It's been really awesome because I've gotten a lot of unique opportunities. I primarily cover the emergency department. We have a 10-bed pediatric emergency that's connected to the adult side. We also have a 14-bed inpatient unit, so it's kind of just general med surg. We don't really see high acuity like anything ICU or new diagnoses for cancer or diabetes. It's just kind of, we do a lot of EEGs, a lot of hypoxic or asthma, respiratory stuff, things like that. So, and I also am a facility dog handler. I'm a trained handler. So my facility dog and I cover consults for not only pediatric, but adults. We primarily work in the emergency department as well, but we go all over wherever we're needed, and staff support too. So my roles, I would say a lot of procedural based, since we are more of like an outpatient type setting, but inpatient work, doing a lot of normalization of environment, promoting play, normalization, giving parents a break and some respite, just checking in also with our nursing staff to see what else we can provide. We do pill swallowing, I've done before. So lots of different things that you wouldn't think of that you do get in a community hospital. I also say that we do a lot of bereavement at my hospital. So we're a women's and children's hospital, but we also treat men, but we have labor and delivery, and we produce about 5,000 babies annually, deliver about 5,000 babies annually. So that's probably we see the most in Kentucky from where I am. But that also means that we see the most miscarriages. 1 in 4 babies is a miscarriage or IUFD. So we provide bereavement and memory making for those families.
So my name is Emma Hall. I am a certified child life specialist at CS Mott Children's Hospital in Ann Arbor, Michigan. I'm from Lansing, Michigan area, and I did my undergrad at OU. So did both the 4+1 program.
Great. Can you tell us a little bit about your current position at CS Mott Children's?
Yeah, so I right now am I'm full-time employee. My role is classified as backfill, so I fill all long-term leave. So whether it be maternity leave or any type of extended medical leave. So I'm in one area typically for, like 4 to 5 months, and then I'll go to another area for whoever else is on leave. And then in between those times, if there's anyone who's not on leave, which is really rare, I kind of am just like resource filling in where needed if people are calling off or they need extra support in an area one day for busy schedule or whatever needs are wherever they are. So
great. It sounds like you get experience with a lot of different areas with that.
yes, I'm all over the place.
Can you share a little bit about your practicum experience and your internship experience, like which hospitals you were at, what units you were on?
Yes, so I did my practicum at Parkview Women and Children's Hospital, which was an adult hospital with a peds floor. So I worked on their I observed on their general peds unit. And then I also went to the PICU occasionally. And occasionally I went down the emergency department for brief periods, but technically was allowed to with COVID regulations. So I did a lot of observing, but I also was able to do some hands-on things because we were so restricted due to COVID that they felt safe and comfortable with me like doing some hands-on things with kids while they were there. And then I did my internship at Nationwide Children's Hospital in Columbus, which was great. I did my rotations on their burn trauma unit and then in the emergency department, which were very similar because the kids who were in the emergency department most of the time would go up to our trauma unit. So I kind of saw both aspects of that. I loved both of those rotations. And when I went to apply to jobs, I knew I either wanted like a trauma unit or the emergency department, which I ended up getting offers for both of those and kind of just took advantage of those opportunities. So that is kind of how I'm at my job right now because of everything that I loved about my internship and the opportunities they provided my internship kind of led me to where I am now.
Yeah, it like opened your eyes to what you really enjoy and then being able to look for jobs in that area.
Yes, and I think that not everyone has that experience. Like some people go through their internship and those rotations that they absolutely do not like, but then that also teaches you like in the future for a job or your career, like like that's not a population you wanted to work with, but you stepped outside your comfort zone and you were able to do that. So luckily for me, like those were populations that I was very passionate about, but that's not always the case. And I feel like people can get like down on themselves that they didn't like vibe with the like unit that they were on during their internship. But I think it still shows you a bit, like, like it'll still show you that that's not what's best for you. And then when you're applying to jobs, like you can take that into factor of like, I didn't like this wasn't the best version of me, so I'm not going to do this further on.
So what kinds of like hands-on experiences or like special events were you able to be involved in as a graduate student here at OU?
So I started my graduate program in 2018. So I think some of the first stuff that we did was we went to Flying Horse Farms, which I was a part of Flying Horse Farms before coming to graduate school. It's actually where I met Dr. Shabbat and learned about OU's program. So that has a special place for me. So we did that in the fall. And then I also attended the Alumni Symposium. I also did the GLACLP conferences and the student symposiums. I highly recommend those. I think OU does a great job of giving us a lot of opportunities to do different types of things. I also sought out other volunteer opportunities in the Athens area because I think Athens is such a unique area. I think people kind of look down upon coming to OU because there's no children's hospital nearby. The closest one's an hour and 20 minutes. But in Athens, we have such a rural community that has so many diverse populations and people and needs that you get a lot of child life experiences by seeking out the community, and there's a lot of opportunities. So I volunteered with Athens Child Services and did like different childcare events, like there were foster parent meetings and we got to provide childcare and just play with kids, and so doing a lot of that. And then I'm very passionate about bereavement, so I sought out to provide support and volunteer at Ohio Health Hospice in Athens, where they kind of partner you with a client or different nursing home where you get to go visit different people, and honestly just supporting them during their hospice time, having conversations, bringing different books, going to do different events with them. You go to bingo or music, things like that. And so those were non-OU affiliated, but I encourage students to like seek out if you have time and you feel like you can handle it, because it's great to gain experience even when you're continuing your classes and your coursework. Then with OU as well, I did do Give Kids the World, which was a good experience. It was really fun. And then I'm trying to think what else. I think we did a couple of teddy bear clinics. We started really to revamp those. So we did them in a bunch of different areas. And then my cohort was one of the first cohorts to kind of start kicking off the programs with Heritage College and also with our community in Athens with the health department and with the Athens preschools. And so we did a teddy bear clinic with the preschool that my cohort planned, which was really fun. And we started at Heritage College. So going to the pediatrics office and sitting in the waiting room and providing normalization and support. We were the first class to do that. And I'm really, it's been awesome to see how the program has grown and the opportunities that are coming from working with our community. And Professor Mitchell and Dr. Shabbat have really done a great job of, seeking out those resources for students, because there is no children's hospital. And so I don't think that should be something that you should be worried about when you come to OU.
The big one that really stands out to me is when I went to South Africa, Cape Town, South Africa, with the undergrad group. I believe I was the only grad student. I had been previously for a completely different program, so this going back was an entirely new experience and hands-on with child life specific work. And super fortunate and grateful for that opportunity through Ohio University. And part of the reason why I pursued the master's program in general, because I had that background in African studies and I wanted to continue to do that and experience and learn more in that area of the world. So that was really wonderful. We were able to not only tour, but work with some of the kiddos there. And it's one of the only children's hospitals in Southern Africa, not just the country of South Africa, but Southern Africa as the continent. So just a lot of rich experiences to observe and work with the interdisciplinary staff and to really reflect about how I can utilize my child life skills, and just really got the ball rolling for me to go right straight into internship. So super, super grateful for that opportunity.
For the benefits to getting a graduate degree in child and family studies or child life, what kind of, you talked about earlier how you really wanted to become more well-rounded. But do you feel like there's any other benefits of getting a graduate degree?
Yeah, definitely. I think there are so many different facets to our field as child life specialists. There's developmental theory, there's medical knowledge, understanding family dynamics, that it really takes time and many different collegiate courses to get that well-rounded perspective that I talked about, and understanding of what it truly means to be a child life specialist. And I think the ACLP has broken down those facets into required classwork and experiences that make you eligible to become certified, those like 10 courses that you really need. But I personally think that in the eyes of the ACLP, I would have been eligible to complete my internship after my undergraduate experience because I checked off those classes. But looking and taking that introspective view, I feel like I really wasn't ready at that time. I didn't have that holistic view and that well-rounded understanding of what it means to be a child life specialist. So I really feel like for me, there was so much more to learn and so much more experience that I was craving to be able to best serve children and families. So I think the benefit of getting a master's degree was having that time to take multiple classes on death and bereavement, child development, family dynamics, and really just getting that holistic view of our field that immensely prepared me for the challenging and complex work that we do. So I have to be really flexible, adaptive, quick on my feet in the unit that I work on. And those are all abilities that I have from gaining a more in-depth and holistic knowledge of our field. And then also, I think for me personally, working at the institution that I do, any leadership position that I ever would want to pursue, you need a master's degree for. So not only the skills that I gained from getting my master's degree, but if I ever want a managerial position or want to challenge my leadership skills and move up within our field, I have that master's degree to be able to do so. So for me, there were a lot of benefits to getting a master's degree. And those are just a few of them. There are so many more too.
Being in those higher level classes is a different experience. Doing that higher level thinking, the higher level research and all that kind of thing, I think, has helped me be able to better tie that like research and information that I personally, like projects that I did that I like personally sought out things I was interested in. It's helped me to like retain that knowledge and have a better, like more thorough understanding and better application of information like theory and other research that I did during graduate school now in my practice, that I think that just in like the 4 years undergrad, I don't think that I would have been able to apply as well or have as in-depth knowledge of.
Absolutely. It really challenges us to kind of go a little deeper and also find what we're passionate about. I feel like this past year I've learned a little bit more about what I'm passionate about because we've been given opportunities to work on projects that we choose and to research, like you were saying. It definitely challenges you to reflect a little deeper.
Yeah, definitely.
Yeah.
Have that time between, practicum, but then also still going back to school and back to classes and being like, okay, now I've had this experience. What did I really enjoy about that experience? What do I want to look further into? What completely shocked me that I was like, wow, I didn't even know this was part of child life and I want to learn more, and how can I do that and further my knowledge and understanding and all of that. So
absolutely. Well, for me, my undergrad was not related to child development or to child life. So I really needed, those courses, the coursework that's required. And I feel that my master's degree, really prepared me to look at things from like a theoretical lens and to just really have such a well-rounded perspective. And now, that I'm kind of on the other side, and I oftentimes take interns and review applications, while we do accept students with bachelor's, there is something to be said about students coming from master's program, just the way that students are thinking about things really speaks to the graduate level coursework that they're doing.
The last question is this: is there anything else that you want to share with potential students, or some of your favorite aspects of the graduate program here? Just anything else?
I think one of my favorite things about the graduate program is how community-based it is.
Mm-hmm.
The people that I went to school with in my cohort, there was 5 of us. We still talk all the time. I'm in one of their weddings coming up here this year. So I think that going to OU, they do focus on smaller class size, smaller everything, so that you do get that one-on-one time. So I would say, that's something to definitely look for, and something that makes OU stand out is because the cohorts really feel like family and you're given that one-on-one attention.
Mm-hmm.
Which I think is awesome. And the other thing I want to tell students about OU is there's so many opportunities to continue to grow your skills and your experiences with what the professors have created for, hands-on things like teddy bear clinics and Heritage College and vaccine clinics. And you get to do a lot of hands-on things, including, I don't think we talked about it, but the skills lab, where you get to practice things after you've done a practicum or even before. And then just helps you make you a more well-rounded student and also more confident, I would think, and more open to feedback. I think that's something that we really focus on at OU, is being a well-rounded student, practitioner, being open to feedback, and OU really sets you up. The support is amazing from the professors. If you have anything going on in your life, you can sit down and talk to them. They can help you through things. They are really supportive and really open, but they also don't hold your hand. You really have to learn what you're supposed to be doing and really advocate for yourself, which is important too, going into the field. And they're super supportive during your practicums and your internships. I think that's what we all look for as students. Having that support is really important, not only from your cohort, but you get it from the professors. So I think I just want people to realize how supportive and how unique our program is, and how it's continuing to grow, and how it's master's focused with research to really continue to grow our field of child life. And and it's been around for so long. I don't even remember how long OU's program has been around. But that just shows you how strong of a program it is, and it's going to continue to be that way. So I think if you meet with any OU student, you hear the same things of the community and the experiences that you get at OU.
Yeah, absolutely. You kind of hit the nail on the head there, but it was the best experience, and I wouldn't take it back for anything. And I just can't stress enough about how family oriented it is, and just how supported you will, and just, how knowledgeable these professors are, and such a great experience. They're role models that, I will look up to, and they challenged me as well. So they are that great balance of, that support, but also challenging me and really preparing me for those experiences. And, there's always a difference between learning in a textbook and then just hands-on experience in the real life. And they prepared me for both and everything. So, if you decide to go to OU, you will have an amazing time, and you will have a great experience that will definitely prepare you, for working in the field. And I know Jenny and Janelle have been even, finding other opportunities even since when I was a student. So it's definitely growing and it's expanding. So you definitely wouldn't regret that decision.